This is my patient Dex. He's a 7-year-old child on the autism spectrum. He presents with decay in his first permanent molar, number 30, and that's the tooth that we're going to restore with silver diamine fluoride today. I've already discussed the contraindications with his mom. There are none. He's not allergic to silver. He doesn't have any ulcers. There's no changes in his medical or dental history. Mom knows that the areas that we use the SDF is going to be permanently stained, and we've explained all that, and I've explained the procedure to Dex. First, I'm going to show you the tray. You will set this up. Everything's in the sterilization area. You're going to disinfect the tray and put a barrier on it. We're going to get a microbrush and a cotton tip applicator to debride and remove the plaque from the area. We have Vaseline to create a barrier to prevent the staining on his gum tissue and on his lips and his cheeks. We have cotton rolls to isolate the area to keep it dry, and we have gauze to dry the teeth. This is a single dose of diamine fluoride. We would remove this top and we would put the microbrush saturating it into the silver diamine fluoride. Some offices will have a multi-use bottle, and in that case you would have a disposable dap dish where you would just put a drop in it. So Dex has a little bit of cooperation issues. We did offer his mom sedation dentistry because he has multiple cavitated areas, and that was not a financial option. So they went with the SDF. So today, because of his anxiety, I'm not going to use air or suction. He's a little bit apprehensive with that. I'm just going to use cotton rolls and gauze to dry the teeth and to isolate them. So the first thing I'm going to do is I'm going to remove the plaque and the debris from the tooth. We're going to do number 30. Because he doesn't like the ProfiJet, the Profi angle, you could use a brush to debride the area, but today we're just going to use a cotton tip applicator to make him more comfortable. So we're going to remove the food debris with that, and then I'm going to take the microbrush, a clean one, and just go into the grooves. Make sure that's real clean. After doing that, I'm going to take the Vaseline, and I'm going to create a barrier to keep the staining away from his lips and his gums, and his gingiva. I'm going to go a little bit above his lip to protect that area. If it does stain, it will go away in about 48 hours, but we're going to do our best that there's no staining on his lips or his tissues. I'm going to take it and I'm going to put a barrier on his gingiva, his gum tissue, and on the inside of his cheek. Then I'm going to take cotton rolls and I'm going to isolate the tooth to keep it dry, like that. And I'm going to use gauze because Dex doesn't like air either from our air water syringe. So I'm going to use gauze to dry that tooth, and it is perfectly fine with this procedure to do that. And I've already dipped my brush into the silver diamine fluoride. It's saturated. And I'm going to coat that chewing surface, that occlusal surface, for a good minute. It has to be at least a minute. Best practice is 3 minutes, but at least 1 minute. And for time purposes, we're going to pretend that a minute has gone by. So after we're finished, we're going to remind Mom that he can't eat or drink for 60 minutes and that she needs to return in about 6 months for the doctor to check the tooth to make sure that the cavitated area is hard, and it needs to be checked again in 1 year. If it's not, then we'll need to reapply more silver diamine fluoride.